you alluded to this before, the kind of the I call it a niche role, but it's hardly a small niche that Next Level has chosen to fill with your healthcare provisions. Talk about how that's creating new access benefits and opportunities, if you would.
There is an unaffordability crisis happening, and that is definitely impacting access. And what I think we haven't discussed yet is, Dr. Lynn kind of alluded to it, we treat in this country mostly on a fee-for-service basis. So generally people come in and they pay for each different service that they get at the facility that they go to. And unfortunately, what I've read recently, that up to 30% of a medical bill is actually just covering the cost, the administrative cost of getting paid for that visit. What we've done at Next Level is actually, even in our fee-for-service portion of our business, we've insisted on case rates that are a flat rate that people pay no matter what, so they can know what they're going to pay before the service happens. And I'm hoping that, in terms of your access question in another light, that the giving people some confidence that they are not going to get some insane bill when they leave our facility allows them to come and use our centers and maybe relieve some of the pressure off of the emergency rooms, where people traditionally have gone because they think that they don't have to necessarily pay if they go to the emergency room. And what we're hoping is that these kind of models, first of all, we see that they save money because people begin to use the lower level services like what we provide, instead of going to the more expensive ERs and specialists when they don't need to. But then the other thing is that we hope that it really sets a precedent, and we begin to shift in this country from doing as much fee-for-service into doing more value-based and cap models, which will hopefully control the costs, which is really what's driving all of the concern right now in terms of how people get taken care of. But we're hoping that we are training this generation, the working generation, on a new way of using the health system. So we're technology forward, we are using team-based approach, we incorporate mental health, and we incorporate lifestyle coaching and things like that, and even frequent check-ins by non-physician team members. And all of that is cost reduction for a single patient. But what we're hoping is that these patients then age into the Medicare years, and they are healthier and living more functional lives, and even better, that they know how to use the health system in a way that will cost less.